one. Wait for the pledge of allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Welcome, everyone. First item, the approval of the minutes from our meeting on April 8th.
I'll make that recommendation. I've looked over it, saw no errors on this one.
All right,
I can second that, no changes.
Having a motion and a second, all those in favor say aye.
Aye.
Those opposed? Carries 6-0. Next item on the agenda for this evening is JCVT.
Council, how are you all?
Great.
Good. Thank you, Heather. Thank you. I'll give you your $20 later on. Get me first on the agenda. Thank you. So I'm the president of Jefferson County Board of Tourism, and it's a fun board to be on when you look at your accounts every month and then you have the ability to spend to projects and partnerships, which is certainly a lot of fun. So what we did, last year, part of this process is we need your all's thumbs up, we need your all's approval for us to reallocate some monies that we have so we can spend at our next grant cycle, which is in August. And I just kind of want to recap what we did. We spent $450,000. We chose to spend $450,000 that you all approved in our first grant cycle, which was in March. We were going to do $350,000, but because we got the innkeeper's tax increase 3% higher, where the income is greater this year, we have enough capital in order to have spent that $450,000 in March, and now we're requesting another $100,000 that we have the money to be able to allocate for partnerships and projects. But I want to share with you what we did real quick in March, which I think is pretty fun. And anytime, stop me, say, hey, Trevor, what is that? But they're fairly self-explanatory. It's a pretty long application that we review, it's like I was saying in the beginning, it's a lot of fun to be able to allocate these monies and see them succeed, therefore attracting more tourists. They stay here, they spend the night, we get more innkeeper's tax, rinse, repeat, recycle. So we ended up spending $50,000. We ended up granting $50,000 to the Friends of Ohio. We ended up allocating $30,000 to Unbroken Circle, $40,000 to the Madison Area Arts Alliance, $22,000 to Madison Music Movement, $12,000 to the Madison Rodeo, $25,000 to the Madison Traffic Control, $75,000 to the VMI Trolley, $15,000 to Mad Hop, $40,000 to Madison Wayfinding, $11,000 to HMI, $10,000 to Regatta, $12,000 to Jefferson County Historic Society, $10,000 to Madison Main Street Farmers Market, $7,000 to Kindred Folk Society, $7,500 to the Visitor Profile, $18,000 to the Casa Car Show, $15,000 to Madison Bicentennial Restrooms, $10,000 to Nights Before Christmas, $10,000 to Chautauqua, $10,000 to Riverfest, $5,000 to Riverfront Development Poker Run, $4,000 to Main Street Wayfinding, $4,000 to the historic Eleutherian College, $3,000 to the Incomparable Radio Theater, $2,500 to Juneteenth Celebration, $2,000 to Salvation Army Poker Run. So that totals up $450,000. We have another grant cycle in August. We're needing your all's approval to allocate the monies that we have, transfer over for our next grant cycle in August, and we would like to allocate $100,000 during that time.
Can we get copies of that?
Sure,
Okay,
absolutely.
thank you.
I think that you guys have that out there on your website.
We do.
Tell me the difference between the wayfinding funding and how that would be different from the Main Street wayfinding.
Great question. So Main Street wayfinding asked for 8,500, and then, where's the other wayfinding? Madison Madison wayfinding asked for 40. So what happened was Tony and Austin, their respective groups sat down like a month before to talk about wayfinding and how they wanted it to look. They agreed on how they wanted it to look, where they wanted it allocated, how they wanted to steer tourists to the east and the west. And what we chose to do was have them work together. Instead of spending $48,500 on the same thing, we would spend $40,000 and have them, because they were singing the same song. They just weren't on the same page yet. So we
Main
gave,
Street wayfinding, obviously, that check, so to speak, is going to Main Street Madison, but when you said Madison wayfinding, I thought, I don't even know what agency that is. That's really going to the city of Madison.
it's going to the city for wayfinding. Yeah, and then we're giving, where is it? We're giving, as for 8,500, we're giving 4,000 to Main Street wayfinding to Austin. They are allocating it to the businesses on the east side and the west sides to steer people to go east and west. So instead of spending 48,500, we're spending 44,000.
Obviously, most likely all of the city of Madison's request for wayfinding would be signage within the city of Madison limits.
Correct.
Most likely not anything outside the city walls, so to speak.
Correct.
And what is, I really did not recognize, pretty well connected, visitor profile and radio theater?
So radio theater is podcasts that have, don't quote me on this, but have X amount of thousands of followers. And there's a lot of people that listen to it, and they put blurbs in there about come to historic downtown Madison, come to Jefferson County, Hanover College, Clifty Falls, the beautiful riverfront, those types of things. So they put blurbs in there. We felt like it's kind of a little diversification to touch a different market, maybe. And then
The visitor
the
profile.
visitor profile, Andrew Forster came in, had a lot of information with AI allowing us to truly dig down the question of why are we here and why are we coming? We think we know, we probably do know, right? But it's more data for us to make better educated decisions on allocating these monies. Good question.
So you're requesting an additional 100,000 on this grant cycle than
Correct.
what you normally do?
Just out of curiosity, you mentioned Madison Traffic Control.
Yes,
Or-
that's another one.
Give us some background on that if you would.
I'm gonna have to come back on that. I don't know.
I would imagine it's for the city police to run their programs for
I just,
traffic stops.
Oh, Dave's here. Dave.
Or it's the bigger traffic, not just
The machines.
the little, but something bigger and substantial so people don't run over other people when they've got the roads.
Oh, you're right. I was thinking of electronics. No, you're exactly right. To prevent people from going down into festivals, and killing people.
Barricades and
Yeah.
stuff.
I think there were,
Yeah,
I read
Dave,
something
thanks.
about the new technology. Obviously, the concrete cinders, for example, that are used for Chautauqua are extremely labor cumbersome. I mean, they're ridiculously heavy, obviously.
Correct.
Yeah, there was new technology that
So,
was coming out.
and Dave, step in anytime, but I think to do it with the retractable poles that go in, and those are hundreds of thousands of dollars, right? In order to do a corridor, in order to do an area, because it is labor intensive. They're talking about how labor intensive it was. There's new technologies out there that it's less labor to be able to put those things in and bring them out.
So we don't have any installed at this point,
We just allocated the monies last month,
okay? Because they just keep moving concrete barriers around right now.
right now, yeah.
Because I've recommended this for the last 5 to 10 years to the city of Madison.
I think it's a good recommendation.
So I just wonder I'm gonna see it before I pass away.
Hey, you're capped for 9 lives, so I'm sure you will. Those are good questions. What other questions we have? Dave, thank you on that. I drew a blank on it.
Find the number.
If you want to go ahead and vote now, then we just will not do that when we go through our normal sheet, but it'll be included on the resolution.
If you need some more clarification on the visitor profile, that tends to be in marketing, where the VMI staff is doing all kinds of data reach out, and that is proving to be very beneficial in getting new people here, and why they come here, and what they want to do when they get here. It's just, wouldn't you agree with that, Trevor?
Oh, yeah. And we have, we have the STAR report, we have placer data and economic impact calculator right now, which, we didn't have those things 4 years ago. And we invested into those things because there's so many metrics. And if you talk to other visitors, or you talk to other communities and their CVBs, or you talk to other communities, their visitor centers, they have that data. And they're gathering that data to be able to recruit and bring in and retain new people and more people. And we just didn't have those tools. And it seemed like, well, Regatta, they brought in a bunch of people. Chautauqua brought in a bunch of people. And we don't know how many. And we don't know where these people, where are they staying? Are they staying there for 30 minutes? Are they staying there for 6 hours? Where are they coming from? Are they coming from 35 miles or more? Are they coming from 50 miles or more? If they come from 35 plus, they're probably spending the night. Where are they herding? Where are they pooling? How are they moving? What time of the day are they? What's their average income? What's their sex? What's their race? What's their, all those things. It's just information that helps us make decisions on how we market and how we steer and how we allocate these monies.
Have we seen some other counties do what we chose to do, obviously and follow suit with many others before us, an increase of those innkeeper tax dollars? I think there were a few other counties kind of on docket to also.
Andrew'd have to talk about specifics on that. I went up to the Capitol once with him. He was up there twice, maybe 3 times. But once we made the push, there were 2 other communities that piggybacked on us.
And collection of those as far as beyond hotel entities, but all things, obviously VRBO, short-term rentals, our B&Bs, I know there was some questions previously about proper collection, faithful collection of we're not seeing any problems in that realm, Heather, as far as
No, I
so
do
many
not
different
foresee, we
lodging
still
entities
have, people coming in and actually filing those claims in person, and then we also receive some from the state, from the Airbnbs and the VRBOs, where everything is filed electronically.
When we do our Airbnbs, it's just, Airbnb just collects it. It just shows your line item. We don't have to turn any of it in.
Takes the headache out of it.
Are there any additional questions? If there are no additional questions, we'll need a motion to approve the additional $100,000 as requested.
I'll make that motion.
Motion, do I have a second?
I'll second that.
Motion second, all those in favor, say aye.
Aye.
Opposed? Motion carries.
Thank you all.
Thank you.
I'll get you a copy of it. Thank you. Yeah, absolutely. Hey, thank you all again.
Good luck at your game.
Hey, I appreciate it.
Up next on our agenda is Norton's.
Good evening, everyone. It's good to see everyone. I haven't seen some of you for a while. I'm Carol Dozier. For those of you who don't know who I am, I'm the CEO at Norton King Stars Health, and I brought with me Rachel Sharp. And Rachel is a local person, but she's the foundation of our Norton Healthcare Foundation. We have Adam Field, and Adam is the System Director of Planned Giving and Major Gifts for the Norton Healthcare Foundation. And I have Shane Williams, the Director of our EMS, back there. I think everybody knows Shane. We're here to ask you to participate in an important project for a service that benefits the entire county. We're planning to build an EMS transportation hub. The current building on West Street, and if you can buy it, is woefully outdated and it's beyond renovation for the EMS needs. And that's a beautiful new one. But the new location will be on the hospital grounds. Norton is donating 4 to 5 acres of prime property for this ongoing operations for this service. We hope the location will minimize cost and improve efficiency. That current building is not very utility efficient. About 80% of our runs are on the hilltop area, so we're spending a lot of time going back and forth back to the base. So we hope on gas and wear and tear in our buildings, and then of course response times as well. As you may know, the hospital has run EMS services for the county since the mid-80s, and we're proud to be part of this service, and we value our partnership with you. And we do appreciate the recent support that the county has given us. Many counties have had to go to an ambulance and EMS tax, and I'm happy to say that thanks to our organizations, we have not had to do that in our county. EMS is not a profitable service, but one that aligns with the Norton Healthcare mission, and we're committed to continue for the county. There is a nationwide shortage of first responders and EMS professionals that is not expected to improve. In addition to the 911 calls they answer, which is about 80% of their calls, they also transport patients to higher levels of care across Indiana, Kentucky, and Ohio. They battle weather, respond to trauma, accidents, fires, illnesses, and other conditions that most of us will never experience. In addition, they support festivals and sporting events in the county. So no matter who provides your health care, this project is really about Jefferson County and keeping our EMS strong so that in a dire emergency, it's there to respond for us. We need this service to continue. I'm going to turn this over to my partner Rachel here.
All right. Well, thank you, Carol, and of course, thank you to Heather for helping me get this set up to meet with you all tonight, and thank you all for your time. As Carol said, my name is Rachel Sharp, and I am with our local King's Daughters Foundation office, which then is now a part of Adam's office with Norton Healthcare Foundation. I'm a proud Jefferson County resident of 12 years now, plus my 4 years as a Panther. I'm sorry. I know, okay. Oh, you're a Panther? I was like, look at that trend.
So I got 3 generations.
Yes.
How many you got?
I'm one.
Lots
I'm
of
one.
Franklin connections too.
Yeah.
I got a Franklin.
True
connection,
Panther
too.
right here, and I like it. All the Panthers are sticking together. And I'm very excited to be working on this project with Shane and Carol and the foundation. And building a new EMS transport hub, this is more than just an investment in infrastructure. It's a powerful commitment to our county for a healthy, a safe, and resilient community. This hub will serve as the heartbeat of emergency response, drastically improving response times, budget and maintenance efficiencies, and the ability to save lives when seconds count. It means better support for our first responders who have dedicated themselves to caring for us, and a more connected community that ensures no one is left behind in a moment of crisis. By coming together as a community to build this, we're not just preparing for emergencies. We're building a future where care arrives faster, stronger, and more efficiently for every member of Jefferson County. In these tough financial times, when uncertainty touches nearly every part of our lives, it's easy to feel unsure about the future. But one thing we can always be certain about is the importance of our EMS and healthcare system. They're the backbone of our community's well-being, the first to respond when we're at our most vulnerable. Supporting our new EMS transport hub is a declaration to our community that no matter the challenges we face, we will stand together to protect what matters most: the health and safety of our families, friends, and neighbors. So even in uncertainty, we can build something strong, reliable, and life-saving together. So again, I thank you all for this opportunity, and you all have the proposal. This is for you prior to your August budget meeting coming up. We also would invite you all, if you feel like you would like to come down and see our current facility. Shane and I would be happy to give you all a tour so you can see it. And you can do some digging and ask maybe Shane some more hard questions than tonight. But we really appreciate your time, and now we are all here for you and your questions that you have.
Could you pass around the
Yeah, we
layout?
can absolutely. So I know this is in your packet, but here's a nice bigger version. If you'd like to take it around, pass it around. And the nice thing is it's going to be on our King's Daughters campus, main hospital campus. So the land is being donated to the project.
So you could hold 10 vehicles, up to 10, two in each bay or one? Just
No.
one?
There's one in each bay going down, there's 6 bay doors going across, 2 chase vehicles would probably be going out the back as a drive-through stall.
That's what I figured would be right.
Yeah.
So 6 of them.
Yeah, because we currently have 16 that we staff at various times.
How long do you expect the project to take?
From the start of groundwork,
Yeah.
probably a couple of years, once you break ground. And that's all gonna depend upon, you know, the weather permits and all that kind of good stuff that goes along. It could be a shorter amount of time. It's, you know, it depends on how quick they get the permits through the state and all that kind of stuff.
Can, does the design that's currently presented here, can you add extra bays to that if you need it?
Yes, it can be added on the end. It was, originally we spec'd out for 8 bays, but to try to get it into cost parameters that were realistic, we had to eliminate a couple bays, 2 minus. We had to.
Right.
I gave it.
I know in our packet that everyone has seen, obviously there was some numbers shared and also commitment recently that people may have seen in press from the Community Foundation, which is a blessing.
Yes.
And it's my understanding, just so everyone knows, there is gonna be an ask of other municipalities as well, with hopes that the city and potentially Hanover may also provide some contribution also to the transport hub.
That's correct.
I would like to ask how many new jobs it might create?
That's all gonna be determined on run volume and stuff. I don't know that there's gonna be a blossoming of new EMS jobs. One, they're not out there. I mean, the people to hire are, I mean, we're right now trying to expand to a 3rd crew at night. To have 3 crews on for 24 hours, and guys, sometimes that's not even enough, a lot of times it's not. But I've got 2 openings for that the people, they're not there as Carol had spoke about, the nationwide shortage it's all over. It's not just in little towns like this. Major cities, everybody is running short and, you know, trying to increase where we want to be because we need it because of our run volume. And we're still waiting to fill those slots.
You may have to recruit, I assume.
Yeah, we have been, yes.
But just saying you could get the employees, how many, you just give me a rough estimate of.
What we employ now or what we
Well,
may.
what you may employ.
We could go to 4 crews during the day and we'd probably still cap at 3 crews at night.
Okay.
Because of run volume, because those goes down, but, you know, that would be seen down the road. And when I say 4 crews during the day, you're talking 7 days a week. That's,
You're
yeah.
talking 3 per
So,
crew?
no, there'd be 4, no, there's 2 people on each crew. So you're talking another probably 4 people,
Okay.
so.
And a newer facility will help with
Help with
recruitment
recruiting.
and retention of the employees we do have. That way they have training spaces, nicer accommodations to shower after maybe a run, change clothes,
It's-
store equipment better, things like that.
Yeah, kind of spread things out, compartmentalize things that need to be compartmentalized that we really can't do right now.
And, construction, what would there be an emphasis put on hiring local when you can?
Sure. we
Yeah.
I think that's
we-
always Norton's goal.
Yeah.
Yeah,
That's our goal.
You know,
Keeping people
to
local.
hire as local as possible. Of course, we've got good resources in Louisville. But the idea is, you know, Norton's invested in Madison. Norton loves Madison. Norton's going to be in the community for a very long time. So we want to make sure that we're building those relationships both at the clinical level, at the public level, and also with construction vendors and any other vendor that's available. So that's a great question, absolutely.
And if you don't know, Ivy Tech has an amazing EMS first responder program, and we have a Norton Scholars program, and our campus and the Sellersburg campus have a partnership with Norton Scholars to help employees be able to take more classes, or students who are interested in working in those fields, then be able to come on and work for us when they're graduated.
Okay.
The continuing education resources are very impressive through Norton's, assisting, yeah, a lot of folks in any realm of the medical field.
Because we home grow a lot of our paramedics, is what I tell people. We're not Louisville, we don't have that abundance. We gotta get good EMTs, and then we take those EMTs, we put them through the Ivy Tech paramedic program, which is, have a great partnership with, now Norton's, but King's Daughters for over 20 years. We've trained a lot of paramedics in not only our county, and all the surrounding counties around us. So it's been it's a good partnership.
I'm not gonna use the term paid for itself, because that'd be a reach, but you did say the utilities you think will be a lot
Yes.
more manageable up here as opposed to downtown.
Sure.
Yes.
And as far as maintenance on the building, wear and tear on the vehicles, gas, so there'll be some savings, there'll be some economic benefit to being up here, on top of the public safety of, you said 80% of your calls are on top of this, so improved response time for sure.
Yes.
So, and that's important.
Yeah.
And would the old building be sold?
Yeah, I already have people calling me about that building, yes. So, and we would use that money
Use that money
for operations, yeah, into the EMS operations. But yes, I have a lot of people already.
Just from the utility side, just to give you an insight, okay?
I don't want to say that, it might scare off the potential buyers.
Well, we have to keep our doors open a lot, so.
Yeah.
The heat bill alone during the winter time to keep that, because I have to keep it, and we only keep it at 60, guys. This is at home. It's 60 because of the fluids and drugs and things like that are on our vehicles. That's over $2,600 a month.
I can only imagine.
Yeah, so
In and out, in and out.
yeah, I mean, when you're looking at that, and so in this facility, lower roof line, things, it's going to, you know, I use that as just an example so that people understand how old this facility is. It was built in 1948, and most of us know it used to be the Demery.
You familiar with that building?
There's a lot of aspects of it that's still the Demery building. Yeah, so that's why we need something new to help attract and to help retain the people.
I am always quick to point out when any discussion comes up in the community with EMS services. So many folks assume, it's a revenue producing area. The call volumes speak loudly, but even louder is when you see on paper the percentage of those who are under or uninsured. And those of us in this room may get that bill to, that it may be a substantial cost out of our pocket sometimes, but also with insurance support. And I know for countless, a high percentage of those calls for this, the poverty level in this community, it is subsidized, it is written off, it is covered by, the providing organization because, most of those runs, not only obviously, I guess I'm proud of the community service and the fact that any, there may be an ambulance right now at the track sectionals going on a half a mile from here, and every football game and every event like Chautauqua and community event, but I think about the volume of runs that really the organization obviously is not recouping any costs for, and I always share that as a reminder with folks when they are kind of baffled at the high cost to run a service like this.
And we are busy. When you start looking at us compared to some other communities, I've had people come work for us that have worked in bigger communities, and they are surprised at our run volume. I mean, it is not unusual to have 2 and 3 911 calls at the same time. And there are some counties and cities and towns that those people are going to wait. There's wait times up to 45 minutes for an ambulance. That doesn't happen here. You've got a dedicated crew of people that, we call emergency assistants on that comes across our phones. They come in street closed, jump on an ambulance and out the door they go, you know, for this community. And, you know, that speaks volumes for the workforce that we have working for us down there. These team members of mine that they put the extra effort in. And this was one of my goals right here, is to get this for them. They deserve, you know, something that is more suitable than a 1948 car dealership to be able to work out of, and, you know, if you guys ever come down, you'll see what I'm talking about.
The amount of lift assist calls you guys get.
Oh my
baffle
gosh,
me.
yeah.
It's just-
Actually, one of my employees sent me a little thing today about a device that assistant lift assist to get people off the ground, you know, type of thing. It's an airbag type thing, and of course, but yeah, we go all the time on lift, and, you know, lift assist, they're not paid for. And we go out, we pick people up daily.
Yeah, 3 or 4 times a day, a lot.
Yeah.
Yeah, and Carol can touch on like reimbursement is
Yeah.
not the greatest.
Reimbursement is not great for these services, and, you know, I've tried to legislate that, and they told me to put an EMS tax in.
Yeah.
You know, there just isn't money anywhere for, you know, additional funding for this kind of service at the state or at the federal level. Everybody's struggling.
We have an older community, and we have an older community, and so when you're looking at Medicare, Medicaid, we call it CMS basically. When you look at those rates, you know, they're 60% of less of what your gross charge is for things. And Medicaid is going to be even worse. We got fortunate a couple of years ago, Governor Holcomb kind of raised that to the Medicare rate, but it's going back to the typical Medicaid rate. And that's unfortunate because it's going to cost us some money. You know, and those things, and insurance companies follow the same thing. So when you think it's all tied in with the big healthcare problem that's going across the nation for EMS and everybody else, it's, you know, there is not an EMS service out there that does not operate in the red unless they have major subsidies. That's the only way that they stand by. Even the big services, everybody goes, well, what about these big ones that are, you know, they contract with all those nursing homes and things that they contract areas with, and that's where they make money. That's where they get those monies and things like that. And, you know, it's great if you could do that, but like we can't with the 911 because you have to be committed to that nursing home and say, oh, you want to take so-and-so there. You just can't do that kind of stuff in our environment. So, but when you're looking at those big dollars, that's where that stuff is, guys. And things are getting cheaper. Brand new ambulance today, and I'm not talking bells and whistles. Brand new ambulance today, $250,000, $280,000. Okay, that's once you put the loads in it and stuff like that, that standards say you gotta have now. You know, we're not putting them up, but a whole bunch of things, that's pretty much a awful lot of ambulance.
I got one more hypothetical question.
Okay.
If this proceeds, does this shine a light for Norton to invest more in Jefferson County in the future?
That's a damn question.
Yeah, no,
Yeah.
absolutely.
It's not a shame question.
Yeah, again, Norton is, you know, we, just at a meeting with the CEO just several months ago was talking about how, you know, Norton is looking at areas outside of Louisville all around to increase access to care. In Jefferson County, be that Norton, or King's Daughters,
Right.
was part of that. We absolutely invest where we are, right, in the community and all kinds of different things. So, once the flag is in the ground, I mean, Norton is committed, so we're not rolling up and going anywhere. We certainly want to be a part of this community for a very long time. And I do think we do have some other things that are kind of being talked about right now, even on campus. I think things can be shared down the road. Maybe I'll let Carol do that when the time is right. But Norton is, that's a big campus, right? So there are some fun and unique and very needed ideas that Norton's looking to invest in beyond this capital project. You know, and I'll just say Norton's committed to the $1.5 million loss that we're taking year over year on this service because it is so needed. And I think that in and of itself is a testament to the investment that Norton Healthcare is willing to put up in the community to say, we know this costs money, right? And we know that Norton is a big organization, you know, we are. But we believe so much in Norton King's Daughters, in Jefferson County, in Madison, in Southern Indiana as a whole, that we're willing to take that on. I know Carol, from just the hospital perspective, has, you know, we've gone through, I think Epic was just introduced and that's always got some speed bumps everywhere. But
We
I
all
know
felt
you're,
that in January and February.
you know, you're doing
It's
some
getting better.
capital investments into the hospital, into the ORs, into different spaces. And that's important, right? I mean, we're seeing that in Norton Clark Hospital. For you all that are familiar with Clark, I mean, it was a dilapidated hospital and is in still need of a lot of repair. I think you guys in Jefferson County are very lucky. Norton's King's Daughter was a daggone good hospital when Norton came in anyway, right? But we are invested to still getting it up to snuff, reinvesting and investing in the community and investing in these partnerships when it's mutually beneficial for everybody, so.
And I'll just echo, we do have a project, an exciting project that we're discussing right now that would just benefit this whole community, and Norton is very interested in being part of that, so I hope to have more soon on that.
Yes.
Tease.
I know. Stay tuned.
Norton's really good at the teas,
Yeah.
but there's a lot to do, there's a lot of need out there, there's a lot of people that need good quality healthcare, and Norton wants to be everything to everybody, right? And we are good at that, but we also need to know that we need to invest in partnerships when we can't be everything to everybody, so that's important as well, but.
I would have a question for you. I work in surrounding counties, so I know that there's a crisis, as you said, in ambulatory services in our surrounding counties that provide ambulatory services. Have they ever reached out to you, like, what ifs, if they can no longer, for example, maybe a Switzerland County or something like that, they can no longer provide that service? Have they ever proposed, can you cover our county if that becomes a need? And
Actually, we did Switzerland County not so many years ago, when there was a change of ambulance things there. And we went in and we covered them for 4 months and things like that with 24-hour service paramedic coverage up there around the clock. And we were able to do that for them. The bigger thing that's going on right now in our area of the country is the non-emergency stuff for the transports, for the doctor's appointments, for a lot of these things that go on that Switzerland County EMS that was providing kind of for this area. But it just, they weren't able to make the dollars and cents match by the end of the day. Chris was talking to me and about they were financially strapped with what they were trying to do, and I told him, I said, but you can't do that.
I just use them as an example.
Yeah,
But I know
yeah,
what
they
you're
were-
talking about.
Well, where I'm going with that is Napoleon is trying to put a non-emergency Napoleon Fire is trying to put a non-emergency transport service together to help fill that void of those things for the different ambulatory type stuff, and they're finding it difficult too, because it's a dollars and cents thing. It's just that there's not a lot of money out there with it, and for us, we're just too busy because we used to do doctor's appointments, everything else, we did everything. And over the years, up to probably 5-6 years ago, we eliminated doctor's appointments. We just couldn't do them anymore. We between 911s and interfacility transfers and things like that, we didn't have time to tie up a unit for 3 hours to do. And unfortunately, the service is seeing that, and that it's not only here, it's across the whole thing. It's just financially, it's very difficult.
So then my point to that is we need to be very thankful for the services that we do have in Jefferson County.
Yeah.
Because in those counties, I can tell you,
It's a struggle.
it's a real struggle.
And when I talk about those long wait times, you know, I mean, especially if you look at Switzerland County, Ohio County, some of these, they got an hour of transport times to hospitals. They're out of the county for an hour. It's nothing for us to go sit on their county line, you know, or Scott County line, matter of fact, too. So,
And there are several more counties looking at a wheel tax, taking those steps, a wheel tax and EMS tax both.
So,
So
I'm very thankful for the services that we do have and very gracious, very, very gracious, because they're in sad situations.
Shane does a nice job.
we all do. So it's a team effort. I got a good team that works for us. They're very, very dedicated.
Thank you.
Yeah, thank you all for your time
Thank you for
tonight.
your time.
And if there's any other questions, feel free to email us or call us.
And you're welcome to stop down anytime, just give us a holler, stop in, we're always there.
Yeah.
Okay, thank you guys.
Thank you.
Thank you.
Next item on our agenda this evening is, health departments.
So I emailed this printout, I also went ahead and printed it for you guys as well. So thank you guys for reaching out with your questions. And I don't know if I went into enough detail on some of these for you, but I'm happy to elaborate more on some of them if you need. I don't really know what else, do you have a email on this?
So we were able to make a correction to Lindsay's budget on a couple items, which I'll be bringing as an additional, or maybe just a transfer next time. So we were able to move the health insurance portion and the PERF portion of allocation from 1159 to 1161, which helped the fund balance. I do still think she has another list of corrections that we are going to move the expenses from 1159 to 1161, which will bring us very close to being in a positive number. I do feel like we should probably move forward with doing a interfund loan, just to go ahead and loan money to 1159. So that, and we do this with other funds, just to prevent us from getting negative in cash and help with cash flow. Also in doing that, I did shoot out the idea of possibly moving some of the public health fund to another fund that could possibly support that better throughout the year until we get back on track. I think if we're more proactive now, that will help us going into the 26 budget cycle, and 26 will be a lot better in moving forward. But as everyone knows, tax revenue is rather unstable at this moment from different changes that has happened, so it does concern me moving more of her budget needs to tax revenue.
Because it's Senate Bill 1.
Yes.
I was gonna say, I would wanna make sure listeners know, not unstable for fault or flaw on our part or
No,
things, questionable things going on in the county.
It's just the tax reform bill, it's moving more
Yes, changes
from
coming down from the
personal
state.
property to commercial and industrial property to other real property tax reform, or other real property tax. And through that transition, you know, in receipts for our levies going to change, and it's really gonna change.
How Jefferson County has to do business.
Exactly. So monies will be tight and monies will be less.
Yes.
So therefore, I think that it'll be an interesting budgeting season.
Yes.
Very interesting.
Definitely interesting. I am trying to work with other departments that have funds that may also have had issues in the past with their miscellaneous revenue and different revenue sources being cut. Try to get ahead of the budget cycle so that our June 30th numbers look a little better whenever we go to DLGF to start the budgeting process. But I think we are definitely at the point where we will have to do budget reductions before we can even submit 26 budget numbers.
And Lindsay, just for clarification also, and obviously it's not necessarily all the details we're discussing right now, but big is an understatement, massive changes to the Health First funding from the state and how that is impacting every county. Is that will not, the decrease of those funds coming to individual counties, that begins July 1st this year?
So the decrease does not start July 1st. We already have the money for this entire calendar year. It was deposited on January 2nd. So the $720,000 approximate dollars were deposited on January 2nd of this year for the whole calendar year of 2025. New changes to Health First, so like tobacco, they've removed tobacco from our core public health services, so I can't spend money on that, starting July 1st. But the actual reduction in what we're going to receive doesn't occur until January of 2026. So it'll be the same number for 2026 and 2027. And in 2027, they will vote for what it will be the next 2 years. It's a 2-year cycle.
I don't think a lot of folks just realize how substantially they're.
It's about $515,000 difference.
To get your attention.
Per year. So
Exciting.
over $1 million in a 2-year period.
Yeah.
But it's, on top of that,
That's not state, that's us.
Yes.
Yeah.
That's, our immunization grant has also been cut substantially by about $75,000 for the next grant cycle, and that does start January.
I think from PR, I think people are starting to hear a little more about the excitement of more public health dollars coming to Indiana. We were ranked so poor, and little publicity as well, being proud that, the commission that really worked to push this through. An increased public health funding. Our own mayor had an opportunity to serve on that commission, and everybody was so thrilled to see those dollars, and obviously very quickly, they are indeed being cut. So just, I just want folks to know that that's impacting things on a local level significantly.
Us in the health department, it's affecting us greatly when you account for the decrease in revenue that's put 1159 in the position it's in. And then you go to the rest of our funds and our grants, and they're all getting cut as well. It definitely, it adds up by a lot. So, we've been great, we're thankful, and we're honestly, it's been nice to be able to pull a lot of our own weight. I mean, if you look at what we operate off of typically, and the majority of that, especially after Health First coming from either miscellaneous revenue or some sort of grants, it's honestly, I think even from the outside looking in, it should be pretty impressive that our department was running mostly off of non-Jefferson County taxpayer dollars. Even after COVID, just the revenue that COVID had brought in is what has basically floated our that one particular fund for.
Right, so I think the increase of revenue that was coming in during those COVID years kind of contributed to this, because we had this false sense of this miscellaneous revenue that was going to continue, and then it shut off. And it slowly started declining, and then it became very rapid.
I mean, even our flu, even if you just look at our flu numbers, they're decreased by half. So our administration fees for flu, and then also our flu, like what we actually make on the vaccine itself from like our private vaccine that we purchase, it's decreased by 50% or more. So it's affecting.
So to be proactive, we went in last year and cut by almost 60%, and that was not enough.
And this was last year we cut 60% for our current year, but the year before we cut every single large lump sum deposit that we had for COVID and made sure that we had cut out all of our grant revenues after SBOA, so we needed to move those into their own funds. So we had already cut those, we had already cut our lump sum COVID payments that we received. And then last year we went in and cut it, what we thought was honestly
From over $1 million to
Pretty
around
drastic.
$400,000, but
when we thought that was,
gonna be closer to 200,000.
and when, not only did we cut our revenue expectations, but we also cut a lot out of the budget
itself.
proposal that you guys had seen for this year. So what I submitted to you guys for and what you guys had approved, we actually went in and cut more from that. So we weren't, we tried to make it as slim as possible. And right now, what you're hearing about us transferring stuff over basically leaves our public health line item, our vaccines, and payroll in that one fund, and that's it. We're not talking about anything else, we're not talking about utilities, all that stuff is getting there. So. On the bright side, when we moved all of our insurance and perf over, and then with what we have, it'll be a much smaller figure. So what we've had with our AP vouchers to move over to make it to where it's only our payroll and our vaccine. So with all the other AP vouchers and all of the insurance and all of the perf moving over, it's a much more manageable number.
I do feel confident with the AP changes that we are gonna be able to make, that if we did a $40,000 loan, they will be able to repay it at the end of the year. This will just fill their cash flow needs.
Okay.
And then
40, not 50 as originally suggested.
right. And then, of course, anything we could do in addition to that, such as re-budget a $50,000 line item in another place for that public health, that's only gonna help going into 2026 so that we will not be right out of the gate fighting this problem again, waiting for the tax draw, is my thought. So I think like I said before, if we're aggressive now, I think it will shorten the stint of
House.
She does have an additional for this meeting, and that additional is, like she was saying earlier, for Health First funding. And it's moving the immunization nurse and her health insurance to 1161 because that grant has been
Cut mid-cycle.
cut mid-cycle. So we do have to do that today. We need to do the loan to get the cash flow back for that fund. But we can think and advertise for June to work on the public health line.
So we're just moving the 13,820 to 1161?
Yeah, we're just appropriating it there, cause that was previously paid from 8907, no,
8107.
8107. So 8107 was her grant that the state notified her mid-cycle that
Okay.
needed
anything
to be
that
discontinued.
got paid out of that prior to March, it was like a really random, like March 23rd or something like that, wasn't allowable, I could invoice for that. So it's everything for the rest of this year for her salary
Okay.
and benefits. It only pays for, I think it's 1 day a week, so 2 days per pay and her benefits. But, I mean, that adds up, so. So we did get reimbursed for the rest of the beginning part of the year. And then the first part of that grant cycle, which is actually the end of 2024, so.
Anyone have any additional questions?
You said that 2025, we will receive all 700,000.
We already did.
So that's for 2025, good. 2026, what did you say that was gonna be? It's gonna decrease?
206.
It's gonna go down to 200, so there's 500 grand
206 and change.
over the next 2026 and 2027. So that's about $1 million difference coming out of it. Okay.
Now, thankfully, a lot of that, so some of that funding, all 206 plus a little bit is actually needed. So those are things that we're gonna have to work on making adjustments with. But thankfully, the majority of that 720 is stuff that which, I mean, it's not a huge blessing, but it was things that we were putting out into the community and extra programs and grants that we were able to give out to health and wellness organizations. Things that we were able to do with our schools, and it's good partnerships, but they were things that we personally weren't reliant on all of that funding ourselves. I mean, this is brand new funding. This is the first year we've received that amount. You know, last year we received half of that. So this is the first year we've received the full amount. So it hasn't gotten to a point where, you know, we were overly reliant on that. But to a certain extent, I mean, about 60,000 of that is legacy funding, which is funding that we've already received. So we used to have 1168 and 4999, and together those were what they consider our legacy funding. Those have since been zeroed out, but that's part of what we received with the Health First funding. And now with the going away from the immunization grant, that's typically about 80,000. It's gonna be not even $7,000. So that's gonna have to, some of that stuff's gonna have to go into there. And then we have another grant that we have 2 employees that was all deliverable based. The goal was to have them roll over into that as well. So basically all of those fund dollars are spoken for, plus some, where we're still gonna have to make a lot of adjustments and, you know, small budget cuts here and there that add up to larger things. Thankfully, we've all got brand new computers, and we're hopefully gonna weather that storm when it comes to like larger main purchases. But we've got, you know, our immunization contracts and stuff like that. We've already quit our advertisements with the radio. If there's just certain things that we felt like we couldn't continue to do in good conscience.
Question, since the shots and immunizations that you all distribute are dropping, the CVS and Kroger's and Walgreens, would they cover most of those or some of those that we could let go of some of the shots and those
Specific ones?
food, pneumonia?
So if,
Then you wouldn't have to worry about storing up in and.
as local health departments, we were charged with having all of them. It's a state requirement to have all of them or have access to all of them for people. So we have 2 different free vaccine programs that are provided by the state, one for adults and one for children. And then we have the private vaccines, which is what gets allocated into the public health line item. That's what that money is for. Unfortunately, we have to carry all of those, but we're very up on our vaccines. We don't over purchase. We are, if we get to a point where we're, you know, reaching or approaching an expiration date on those vaccines, and it's not one of the companies that will refund us or credit us back for, you know, expired vaccines, we're very big on like not wasting anything, so we're watching that carefully. We had something come up recently where we actually went out and found 3 people to give those vaccines to that needed either updates or something. We just searched and searched for a while until we found people, which we've done as well with student and like school vaccine stuff when we didn't get a really good outcome when we sent out the paperwork. And then the school did a great job of sending it. It was just the responses were really low. So we had a couple people sit down and make those almost cold calls. I mean, they really weren't, but they kind of were. They had received paperwork, they just hadn't filled it out and returned it, and we knew that they needed to do it, so they sat down and called several, and we ended up getting 6 more students, which doesn't sound like a lot, but it, you know, we started with one student, so it definitely helped our numbers with that. But we have some things where we're working on drumming up that miscellaneous revenue to help cover our costs. So we have some ideas in the works to see if we can get that up, but it's just down right now.
When you say you're down 50% on immunizations, what was that number look like? Was it 500, now it's 250, or?
So it's just those 2, it's just COVID and flu. So in 2022 for flu, it was I'm adding our administration fee and our vaccine, which are 2 different things. The administration is what we charge to actually do the shot, and then
I'm just thinking head count, people walking through the door.
so head count itself, we're down 1/3. From 2023 to 2024, we were down 1/3. So in 2020, I think those numbers are on that sheet in front of you. In 2023, we had 3,033 immunizations. And in 2024, it dropped to 2,014. It's in the key notes or something up at the top. But funding wise, from 2022 to 2023, just our flu dropped by by almost 30, a little over $30,000 from 2022 to 2023, and it dropped another 3,000 in 2024. And then COVID is something of its own. We went from $67,000 in admin fees in 2022 to a combination of admin fees, and that's when we had to start buying private vaccine. So it's a combination of admin fee and a little bit of what we made off of the actual vaccine, because in 2023 we had to buy our own, or started to. We went from 2022 having 67,000 to 2023 240,000 to 2024 where we made about $20,000. And these are just those 2 vaccines. I can do a larger breakdown with a little bit more time on all of our others, but we're seeing a little bit of downward trend in some of our other.
Yeah, I was just saying a 5-year, well, unfortunately COVID, we can take it out, a 6-year trend, like 19 to current, how was it, or maybe even how was it in 18 and 19 versus what it was in 23 and 24? Because you kind of have to take that middle peak out.
And not to make it political for people's opinions on vaccinations and speculations of why those numbers are down or people aren't getting them than they were before. I'm just curious, other health departments that are facing some of these same, neighboring counties aren't giving as many COVID and flu shots as they were, a couple years ago either. You know, our county's beginning to get creative even when you think about, you know, health departments shouldn't have to think about what'll make us money. It shouldn't, it's there to service the people, but I'm just curious, what we would deem as, you know, free services before involvement with, you know, car seat safety checks for parents and giving, just when you think about public safety and how, you know, are you seeing some other counties thinking, you know, we're gonna have to start charging for those kind of things? Or, I mean, is that tunnel vision, like, how are we gonna make money?
I'm gonna go with no on most of that, just because the basis of most of the services at the health department is an educational aspect of, let us show you how to put your car seat in.
Yeah.
The free car seats that we have don't get paid for from our tax levy here. It comes from a grant that we're not the recipient of that grant, someone else is, and they distribute the car seats, which is how we get those. So it's not in good faith to charge for the installation of a free, you know. It's just, most of our services are honestly free to us, which is how we make it free.
I don't think it's uncommon that health departments across the state are seeing this type of issue though with funding. We did a budget finance class and she literally used the example
of
the health department's miscellaneous revenue decrease and how, you know, in certain cases it may take 3 years to get back on track. And Pam and I looked at each other like, you know, like
3 years, hopefully not to be back on track in January.
Right. So I do not think it's uncommon. Health department and highway department have taken a major hit over the last few years.
And I wasn't suggesting
And it's
we
across
should
the
be
state.
thinking revenue
Yeah.
producing, but I was just curious. Yeah,
Is there
you,
any, what
yeah.
are your thoughts? Our biggest thoughts right now are how to increase, the billable service that we do have. So the things that we're already billing for, how do we,
Like immunization.
yeah, how do we increase those numbers? So that's what we're kind of working on right now with some little, but, you know, I'm going through it and having one-on-one conversations, so I haven't even really fully included all of my staff in that yet. But we are working through, ideas on how to take what we already do and expand that a little bit.
When that service is already being provided at XYZ places in the community, you know, how do you get yourself out there as a place that you're the place to go to get the immunization versus a CVS, Walgreens, or Kroger?
I think the difference lies in our ability to move. So, and our ability and willingness to meet people where they are instead of making people come to us. I think we're gonna try to capitalize on that.
Mobility, like a mobile unit. You had mentioned earlier about no funding for tobacco. Can you expand on that a little bit?
So one of the core
Not
public
that
health,
it's my big issue, but.
so one of the core public health services that this Health First Indiana funding was founded on, that says, like, when we signed up for it, we said we're gonna tackle all of these to the extent that the state elaborates that we need to tackle them. Like, we can't just say, oh, we're doing stuff for that. There's kind of goals and angles at all of these, and one of them was tobacco prevention and cessation.
Right.
They had goals on random statistics for that. Like, we have to make, each county has to make KPIs. I actually had to change one of mine because our numbers were so high. Now I have to change one. We had 2 of them dealing with smoking, but one of them had to deal with pregnancy, so we're allowed to keep that one. We're allowed to keep them that have to deal with maternal and child health or students. But since this one is not dealing with students, I have to change it. So basically, when the new budgets came down and the bill change happened, they said no more money from HFI can be spent on tobacco prevention and cessation unless it has to do with other core public health services, which would be maternal and child health is one, student health is another one. So if it has to deal with these other categories, then we can spend money on it. Otherwise, we can't just spend money on tobacco prevention and cessation.
Gotcha.
there's still a state agency now called TBC, used to be called ITBC, which has definitely brought on
But
top
it's not
of
in the health
funding.
department, right?
It is from the State Department of Health.
It's from the State
It's-
Department of Health, but it doesn't
yeah.
come from local health department.
And
Right,
even
so
that-
you don't have to administer it,
Right,
that's what
and
I
that
just wanted to
funding,
know.
Jefferson County has been a recipient, but unfortunately, that funding this year also was cut. Yeah, so.
So as far as where
Counties
you're
are-
concerned, it's not, you don't have to keep track of it and, okay, gotcha.
Just sad that a problem that's big for Indiana, that the health first funding can no longer even target that particular area. And starting July 1st, Indiana has a $2 per pack increase.
Which is
On
also,
tobacco.
we're not allowed to spend money on tobacco anymore. It's
Yeah.
July 1st. So-
Yeah, but that just passed, so starting July 1st in this state.
But who knows,
Tobacco
next
cost
year, it may be
increases.
something, a whole but another bag of tricks, so you never know.
But-
Everything changes.
But in the next grant funding cycle, with the federal and state level looking at the status of health a little bit differently than the previous administrations, is it possible that funding could come back in different ways through the health department?
So the governor has made some, I don't know what you call them, sorry. He's made some new statements and declarations about, the health of Hoosiers and the way he's wanting to go. And, I think that there's, maybe not now, but I think potentially in the future, there could be different avenues with nutrition and things like that could be giving money out. We're not in a position to know. But I will say that the avenue is going more of a nutrition based, and so I think that in the long run could turn into something. We just,
Don't know what yet.
we don't know what or even if it would.
Mhm.
But I'd say that there's always a change in grants. You can see it across the board where people focus on one thing and then they go away for a little bit and they come back with something new. It's not uncommon, it's just when it happens, it doesn't make it any less hard to navigate and figure out how to make it work in the time being, and that's what we're doing right
Change.
now. It's just a change that we have to weather, and hopefully when the positive comes back, we'll find a way to put that to good use.
As when we were sitting in that. It's like a big change, and it's the biggest one since 1970s, so it's just a different way of thinking, and so we'll implement it and just work through it.
So this grant 8107, it's just gone, right? You can't
It's
even
not
apply.
gone, it's
Okay.
just this grant cycle, they cut me off before at the end of it, so in March, they cut me off. I believe I'm allowed to spend some things out of it, but I haven't got clarification exactly what I'm allowed to use it for.
So it's not completely discontinued, it's
No,
pronounced.
and I know that it's coming back in July, so July 1st starts our
Okay.
grant cycle, but that's where it comes back and it's $6,800 instead of $80,000.
Okay,
So there's
Alright.
something to be had in there, but pretty much all of that will go towards our technology requirements for keeping our free vaccine programs.
gotcha, okay.
I'm hoping it covers that.
Sorry, so many questions, but the
No.
more we know, the better off we are understanding your needs for your department
No.
when it comes to budget time, so.
Yep, we have special refrigeration and freezer units that we have to for our vaccines, and then on top of that, we have data loggers that have to be plugged in to relay the temperatures to a cloud. My phone goes off constantly if it doesn't, if there's an internet disconnect or something, like it tells me that I hasn't talked to somebody in a while. If it gets out of range by 0.1 degree, it'll send me a text so, and we have to have people that are on emergency standby, so I have to have someone that's 24 hours, which in this case is me, that gets a notification per just the agreement to be able to do our free vaccine programs. So most of that money from that immunization grant will, if not all of it, will go towards making sure that we're meeting that requirement.
I know it's only been a couple days since we talked on Friday, but I look forward to hearing back from you on what you're able to find out on the insurance billing. To be able to get that software, get that instantaneous
Yeah.
access versus having to wait.
I got some feelers out, since it's not something that's customary for most people in this state. It might be a minute, but I like the idea. I think it's a good thought process of weighing. So it's in your
The Vax
printout.
Care.
No, it's the one about the appointment schedules. I think it's like the second one about finding like a billing system that would allow us, that even though we might have to incur a cost to do it, it would allow us to potentially do walk-ins, and which would allow us to increase, it would be, the goal would be that we would increase our immunizations because we would be able to do walk-ins.
Honestly,
So to offset the cost of the billing.
we live in a drive-through society. If you can't go get it done right now, people aren't gonna do it, so.
Yeah.
And they actually do that at Walgreens and CVS, you just
Right.
drive through and stick your arm out.
Yeah, it's nice. That's their pro, so that's why I said right now, our current pro is that we can meet people where they are instead of them having to come to us, and I think we need to,
That's a good angle to look at as well,
yeah, so I think that's
Going to
something.
a factory.
That was my next thing was,
I
you know,
got a
any
list to
company
send you.
opportunities or anything like that to do.
If you guys came up with any ideas during this, feel free to type them up and send them to me, or just call me tomorrow and I'll type them up for you. I don't mind, ideas are great, so, I can
Used to do
send
that
those
now.
out too.
Flu shots back in the day.
Didn't the health department used to come to the factories and do shots?
We have a few places that we do that with, so.
The hospital did as well. I'm gonna send you some contacts.
Yeah.
It would definitely help. Plus you could plan for it, you know, you're gonna go get 200 vaccines at this factory, then.
I was
That
gonna
would be
say,
very beneficial.
I go to Scottsburg a lot on the weekends, and it looks like they do some type of a drive-through. A lot of people participate in that.
So they did an emergency preparedness drive-through recently, where they used their emergency preparedness grant for items to give out to the public, so they did like emergency radios. They have a different system than what we have, so when it comes to vaccines and billing, that's the Vax Care, where they don't really get a very large portion of the administration fee, and they don't get to bill for the vaccine. So their revenue is very low with that. I think when I talked, I think it was a ballpark of my memory, because this was not an email. I think it was like $30,000 for the entire year for revenue for all of their vaccine administration.
Not very good.
It's not a
Right.
high.
But like if they could say this Saturday I would be coming through and you guys could run the insurance in advance, then
Oh my gosh, yeah.
that would be an amazing.
Or even just
opportunity.
if there's a software that we're able to
Or
load
the
it in,
software.
and we can load it in that moment where instead of having them come in, we can
Right.
actually do it, you know, in a matter of minutes to see if they were, I think it would make a big difference, but we have to find the right system for that. Cause it has to be something that can be done regularly and not reliant on our billing coordinator to verify everything, because she has time off. She's entitled to her time off. So I mean, if we say we're open all the time, no
Yeah, 3 or
appointment
4
needed.
people in your office should
And then
be
when
able to
she's
do it.
gone for a week, we could lose a lot of money by giving immunizations to people that aren't covered. So it has to be something that's user friendly for the staff.
I'd say, as I would today's technology should be pretty user friendly, be able to enter their name, their insurance ID, and it'll either tell you yea or nay, so. That'd be great. Well, thank you, I appreciate the effort, I know it's not always fun, losing funding and trying to make, budget cuts, but, it's still better than the year we had to do 750,000 after the budget was set. So, if that makes you feel any better, I'm sure it doesn't, but, I appreciate all you're doing.
Just know that it could happen going into this budget.
Yeah, be prepared.
We've been very fortunate the last several years.
So I think we're.
So are we holding off till additionals at the end, or are we looking now?
Well, the additional, or the loan for hers, we're gonna look at for June, this meeting.
No, the loan,
It's in there.
It's
so
in here.
we would need the loan today, and we would also need
It's
to
on there.
approve the additional for the nurse.
The 7,200 and the 6620? The 13,820 total?
The loan is blank, so that we could fill in. Originally, I was projecting 50,000,
below
but
it.
we could do
It's right
40,000.
here. It's below it, right?
No, it's not on our
It's not on
sheet
it.
at all, because I
Oh,
was
okay.
just gonna do this when she was here.
Okay.
It was an extra thing that I
Even though
had
it was
to
the
do.
same amount, everybody,
This
you
is
guys were
what I
seeing
have right now.
the
I think we're
animal
gonna
control
break
Oh,
side
and
is
that's what we
40,000.
thought, yeah.
Anyway,
Yeah,
I think.
no, I think we should do 40 should be good.
Am I correct, the
The additional is for the nurse, that is the,
That was the immunization.
$7,200 and the $6,620. That would
Yes,
need to be
and
approved
that's
today.
1161 and 13,820 total.
The June appropriation she was talking about was the change to the budget for 1161 from having to move all of the accounts payable, insurance and perf over to 1161.
Okay.
So that's where you'll see the appropriations for that, it will be in June.
Yep.
Or transfers, or a combination.
Right. I have to get creative.
Oh. Thanks,
Additional
Lindsay.
questions for Lindsay?
Thanks, like I said, just feel, you can reach out whenever, I don't mind, I'll sit down with you, talk it over. I am actually taking vacation on Thursday and Friday for the first time in a while, so, you can call me, but I, have my tablet, I just don't have, I won't have access to like WoW or something, that would have to be a her question.
Alright, thank you.
Have a good vacation.
Yeah. Alright, the item that we have left is the additional appropriations, on the resolution, 2025-008. Those items are the 100,000 we already voted on for the, tourism, 25,000 for the statewide 911, 13,820 on the Health First Indiana, and 40,000 from LIT for the purchase of the animal control truck. Actually, before we jump into voting for this, I'd like to give the 911 director an opportunity to talk to us about the 25,000.
I was gonna say thank you in advance for the very detailed explanation that got. I really appreciate it.
How are you?
I appreciate getting that.
Thank you.
I'll skim over the long parts. I'm requesting $25,000 to be transferred from our statewide 911 account to the Central Square account. And this is to facilitate the move of the CAD servers from the location downtown to our facility here. And in order to do that, I'll need to purchase some, server racks, just the equipment needed to house that, like a upgraded firewall. And so I expect that the most that should reach is 25,000. I don't see it going up that much, but I want to leave a little bit of room in case there were other needs. And so with this, like I said, the money would buy the server racks, upgraded firewall, and any additional hardware needed. So I would like to say that this is a pretty big discount. Normally, a company would charge a lot of money. I reached out to Central Square. They would normally charge anywhere from 20 to 40,000 to do this kind of move. They've offered it free of charge. Our other services that plug into our CAD servers, they would normally also charge, but due to moving it up here with the rest of their other equipment, they've also not charged as well. So this is just the equipment needed to house the CAD servers.
I appreciate you having those discussions and negotiating that.
Sure.
That helps tremendously.
They're good people to work with, we have good relationships, and I couldn't be more satisfied.
Everybody thought that was in there, you know.
I know, that's what I.
It was in the paperwork, because I remember distinctly bringing those up here, and then it just never materialized. So thank you for getting.
Yeah,
taken care
I
of.
want to get it done as quick as possible, move on to something else. There are a lot of other things we could be working on, so. They're currently down in the server room, down at the
So-
facility.
Do you know where the squad room is? You come down the hallway, it goes down to the basement, then there's a door that actually has a door out to the alley.
Yeah,
There's a small room and that's where it is located right now, not on server racks.
yeah.
Stuck in a closet, basically.
And this cost obviously coming from the state 911 account.
Yes, no taxpayer funds.
Yeah, it definitely needs to be done.
Statewide funds.
Thank you for the explanation. I got to thinking about it after I saw the request, and I remember the 25,000 and the item. So I'm glad to see us being taken care of, but like Ray, I thought that had been taken care of previously, so.
Unfortunately not, but we're gonna get it taken care of.
Yeah, it's been
That's great.
discussed
Thank you.
numerous times.
Yeah, thank you.
Thank you guys.
Yeah, thank you.
Thank you very much. I guess we need to motion.
Yeah, so the total for this being, for resolution 2025-008, totaling $178,820. Is that the motion?
All motion.
Second.
All right, motion is second. All those in favor say aye.
Aye.
Opposed? Motion carries. Thank you.
And no formality if any of those individually? Just the
We've done-
resolution 8?
Right, we have processed them both ways in the
Okay,
past.
okay.
We do need to approve the loan, that other resolution as
That's my
well.
next item up. That was 40,000. And fund number,
1159.
1159 is what will be being paid, but we will need to decide, do we want to put the temporary loan? She does have the cash in 1161 that she could repay by the end of the year. We could do it that way, or we could do a loan from Lit, which also has cash reserves.
1161.
1161, okay.
That way it's county
It's all
health. County health.
within the
Okay.
same.
We're all familiar with the need for this loan from 1161 for the health department of $40,000 to help balance things out through the rest of the year. And being a loan that would be repaid by December.
December 31st, yes.
Okay. Have a motion to approve resolution 2025-009 for $40,000.
I'll make that motion.
A motion, do I have a second?
Second?
Motion second. All those in favor say aye.
Aye.
Opposed? Thank you very much. All right. Now I'll turn it over to our audience. If anyone would like to speak this evening.
I just want to make myself available, just in case you have questions about what's going on with the flood and where we are and what to do.
I would like an update.
Yeah, so we had actually had a great interaction with the Whittle Ford female representatives that were here in the county with us. We answered lots of questions, provided, I can't even tell you, countless documents, going back from Oregon, going out and taking more pictures and doing more things, all in business. So what the final numbers and things like that will be, I have no idea. We're waiting on them to make that determination. But it was a great interaction with a couple of guys up here from the public assistance side, and then a better time out running around looking at houses and things like that, and interacting with people out there that really are kind of hurting right now.
I heard
And
a
to
lot
have some
good
feedback
response
about
from
that
the
is-
public.
Yes, so, so we're happy to be able to get out and talk and make some connections and all that. The state has opened up a temporary, $2,000 per applicant fund, if you've been affected by flood damage, and that's with your primary residence, which is difficult for people to understand that, you know, it's, hey, my house got flooded, I pay property taxes, I pay this, I pay that, all of it. And they're checking with your address and things like that to make sure that's where you actually live and all that. So, so it is for your primary home, so if it's a secondary home, whatever you, I hate to say that it doesn't qualify.
How are we communicating that to our residents?
We're talking to the individuals.
Are you?
I think that's getting outside of the individual that we're talking to and getting
Okay.
information to. And so there's a little bit of, there's been a few emails and some phone calls, I forget about that as well, so.
Good.
Which I think is kind of difficult. We try to kind of just give that to the people who knew that needed that were qualified for that to get the information. That's where we kind of kept things, so. You good there?
Yeah, I'm good there. It's
Yeah.
good to know that because, you know, there's a lot of individuals that were impacted that are just summer vacationers, you know? And so they, you know.
And even still, the devastating cost. You know.
Oh, yeah, absolutely, absolutely.
City of Madison had roughly 62 to 64 flood victims in city limits, is that correct?
I think our total numbers for city and county, though, if you're like 54, or 50, maybe up to 58.
Yeah.
And again, it's primary residence, so a lot of people think, all right, I live here like 6, 7, 8 months out of the year, so that's gonna qualify all that business, but there were a lot that just don't, so.
So most of the county was not
Right.
affected with primary residence.
Right.
Only vacation,
Mhm.
trailers and what have you.
Yeah, trailers and RVs and stuff like that.
Yeah, sad, I mean, it's just that, you know, I'm glad it only happens every so many years, all that business. It seems like Mother Nature needs some medication or something to get settled, because I don't think we have seasons anymore, I think we just have crazy weather. And unfortunately, there's snow coming tonight, and there's some potential, and Kentucky's been devastated. Like,
Oh my goodness.
they're even for a big, you know, couple more punches tonight, and an already horrible situation in a lot bit. The tornado alley's creeping this way. If you haven't seen the latest draft of the tornadoes counts across the country, all that business, we are in the red zone now as a whole state. So it's much different than what it was before. Crazy statistic if you didn't know.
Town scares, no, I'm just
is-
kidding. Be
Well,
aware.
yes, absolutely. And so we lead all 92 counties in declarations across the last 50 years, which sounds crazy to me, but that's the number that the state provides, so it's.
Well, it's good to know that they came and that you're aware and people are knowing that they can contact you with any questions.
Yeah, we spent a lot of time with them. We thought it was important to really hammer down as much as we could, all that business, and be available to answer questions. I think a lot of people didn't take much advantage of that. I think the city of Clarksville, I don't think we really did a whole lot, if I remember correctly. So I think we spent a lot of time answering good questions and giving the right answers and giving the right information, the right pictures and the right things like that to kind of push us across the line there. So hopefully it'll be good news when we make a decision about some reimbursement and stuff, so we're hopeful. Hopefully. But yeah, thanks.
Thank you.
Thank you.
Anyone else?
I have a few things. You can go first.
Go ahead.
No, you go. I thought no one was gonna say anything.
So, we got the appraisal back for the campground parcels.
Okay.
We kind of did some estimates our own, but they wanted an appraisal, which is for our good. So the whole 221 acres has been appraised at 2.65 million. The campground portion, the 94.52 acres, is 1.42 million dollars. And that, I think we had about 800,000. That's kind of our county match to the ready fund. We had to put in some, and we're gonna use that, and that makes it even better. Moving to the animal shelter, we're pretty close to a point to be able to start showing the public and getting their interest in it, because a lot of people have said, we want to see what you're gonna build before we will help out. So we're getting there. We are doing some wetland delineation back in there, just to make sure where they've got it set is indeed an okay spot. We don't have to start moving, so we'll get that taken care of. The solar and the, barrel rack houses, those amendments to the zoning ordinances have made it through the plan commission. There is a public hearing on the, sorry, it's a date of your meeting, but they picked the 10th of June for it at the county fairgrounds to have that, public input.
If the advertisement is approved.
Hmm?
I think there might have been a hiccup in getting it advertised.
Oh, was it?
Yeah, so hopefully it is advertised.
She was, Taylor was doing that, but I hadn't heard that, So if you wanna look
It's
at.
a new development.
Oh, okay. If you wanna see a copy of the drafts, we can send them out to everyone.
That would be great.
Okay, they are on the county website too.
Oh, okay, well, I'll just look it up.
Okay, I think that's it. Anything else?
Appreciate the update. Thank you.
Thanks.
Go ahead.
Okay. My only items were, I first wanted to confirm that everyone wanted to set the budget hearings for August 11th and August 12th. We're good with that? Okay. The next thing, do you want me to prepare a letter to try to stay within the 2025 budget numbers for their initial request?
Are you going to take the advice that they had recommended in our class about?
The additional meeting, yeah, I think we will have to, even to give employees raises at this point, we would have to request by special meeting to receive the levy, increase for the 2026 budget. So yes, we definitely will have to be setting that date soon too. I am going to reach out to, my DLGF rep to see the exact timing that we have to do that on.
Because we're supposed to have that meeting. Okay.
And then one more item, the flood dumpsters, at this point, we're over $7,000 that we need to pay. Sarah asked me, do you want me to take this out of our repair and upkeep budget for right now? We need to get this paid. I said yes, but then in the past, I know we have used rainy day because this money doesn't come back sometimes for almost 2 years, it seems like.
And it did rain.
And it was literally a rainy day, so,
Yeah, we are done with that, is that correct?
I do believe so, yes. So, with your permission, I will advertise for an additional to rainy day to cover those dumpsters.
Makes sense.
Okay. I will have that for the June meeting.
No pun intended.
Could have been the whole reason why they developed that fund,
Maybe.
way back then.
Yeah.
We need a rainy day.
It's for that no good rental.
Okay, and that is the only things I have.
Okay.
Anything else from the council this evening?
Motion to adjourn.
Got a motion and a second?
I'll second.
All right. Have a great night. Thank you, everyone.